afternoon, everyone. This is Michael Jackson with the Florida Pharmacy Association, and thank you for being with us today. It is our pleasure and our opportunity to bring to you this special webinar to help prepare us for the coming changes that are happening within pharmacy here in the state of Florida. We have some exciting information to share with you today. This meeting is going to be recorded. For those who have unable to be with us this afternoon, we'll make it available to you on the Florida Pharmacy Association website. This is a webinar format. We are unable to see you. You will be able to see us. If you have questions, there is a chat feature in the webinar that you can pose your question. We'll monitor those and we'll try to answer those towards the end of the webinar presentation for today. We will not be offering continuing education for this session. This is mainly an informational session for our members. And so thank you again for being with us. So this session is dealing with testing and treating for success, and is based off of some legislation that occurred during the 2020 legislative session. And I need to do a screen share. Okay, try again. There we go. And you should be able to see my screen as I advance the slides. So just to kind of whet your appetite here, House Bill 389 was carried by Representative Siroy and Representative Donaldson and Representative Sabatini, and it creates two new sections of law. We're going to focus primarily on the section that deals with test and treat. So it's my pleasure and my honor to bring to you our lobbyist of the Florida Pharmacy Association, and also working with her is Amanda Gorman. So ladies and gentlemen, I bring to you Claudia Devan.
Good afternoon, everybody, and thank you for joining us today. As Michael mentioned, it's an exciting opportunity to talk about what I think is going to be a great opportunity for you to get more involved, and more importantly, in this horrible pandemic, be able to create greater access for healthcare to Floridians. So briefly, let me just tell you the political landscape that we were up against. House Bill 389, as Michael mentioned, was an important piece of legislation that seemed like there at the end it was pretty easy to pass, and it makes just good common sense. However, I just wanted to let you guys know that as your advocates, this was the third session, the third year that we have been advocating for the ability for pharmacists to be able to test and treat for flu and strep. And so finally, we were able to advance it. And just to, again, put a little political flavor around it, the House Speaker, Speaker Oliva, his main priority was expanding access to healthcare, while the Senate, however, was very much opposed to expanding the practice of medicine beyond an actual medical doctor. So that was sort of the tension that we had to work with legislatively and politically. So for instance, the House passed the bill through its three committees fairly quickly, and then the Senate chair wouldn't even hear it for over a couple of months. But eventually, as most things do in the legislature, there's compromising negotiation, and the Speaker and the Senate President agreed mostly to the House version of the bill, and it was passed, and the governor signed it right away on March 11th. So generally speaking, the new statute, which is 465.1895, allows for testing or screening for and treatment of minor non-chronic health conditions. And minor non-chronic health conditions, according to this law, would include, but not be limited to, flu, streptococcus, lice, skin conditions, and minor uncomplicated infections. So generally speaking, while we call it the test and treat bill for flu and strep, it does allow for additional treatment for non-chronic health conditions that would be determined by the pharmacy board. So that's the general concept of what we're going to go into a little more detail. I'm going to turn it over to Amanda Gorman, who works with me and is also a proud advocate for the Florida Pharmacy Association, to give you a little more detail. Thanks, and you'll have a great afternoon.
Hey everyone, this is Amanda. I am going to go over some of the details of what the bill covered and things that you as a pharmacist need to know. So a requirement or requirements for a pharmacist to be able to test and treat under this new statute, a pharmacist must hold a license to practice pharmacy, which I hope you all do. They have to hold a certification issued by the board. You would have to complete an initial 20-hour course. And then with your license renewal every 2 years, you will have to complete a 3-hour continuing education course. You have to maintain $250,000 of liability insurance. And any diagnosis of a disease of public health significance must be reported to DOH, Department of Health. You have to furnish patient records to their primary care physician upon the patient's request. You have to maintain records of patient services for 5 years. You have to use a device that has a CLIA waiver. You have to have a written protocol agreement with the supervising physician and have a written approval from the owner of the pharmacy. You have to provide patients with written information to advise the patient to seek follow-up care from their primary care physician. And you have to display signage around the pharmacy advising a patient to seek follow-up care from their primary care physician. For the protocol agreement between the pharmacist and a supervising physician, it has to be established within this framework. The protocol has to include specific categories of patients for whom the pharmacist is authorized to test and treat for flu and strep. The supervising physician's instructions for the treatment of flu and strep based on a patient's age, symptoms, test results, including what to do if they get a negative result. A process and schedule for the supervising physician to review the pharmacist's actions under the protocol, and a process and schedule for the pharmacist to notify the supervising physician of the patient's conditions, tests administered, test results, and course of treatment. This can be expanded upon based on anything the Board of Pharmacy decides needs to be included in their rulemaking process. So I will turn it over to Michael Jackson, and he is going to cover some more of the rulemaking process for this legislation.
Okay, Amanda, thank you so much for that update. And ladies and gentlemen, this is an exciting time period. These are changes I think are pretty good, are very good for pharmacy. So it gives us an opportunity to actually do some things that we have not been able to do before. But there is a process ahead of us where we have to work on, and some of that's related to changes in the rules. So you have statutes that were adopted by the House and the Senate, signed into law by the governor, but then there are some rulemaking things that has to take place. And I'm happy to share with you today that the draft rules have been released today for our review. So we'll probably try to send a message out to the members about the rule information. But before you proceed, there are a number of things that have to occur first. So what is this am I hearing about pharmacists testing and treating for minor non-chronic health conditions? That's that new statute that Claudia and Amanda talked about earlier that creates under 465.1895 that allow pharmacists to test and treat for minor non-chronic conditions. And you are able to do this under the framework of an established written protocol with a Florida licensed physician or Florida licensed osteopathic physician. And also it expands beyond just influenza and streptococcus. So how do I qualify to assist patients with managing their non-chronic health conditions under this law? Well, a couple things have to happen. You have to be a Florida licensed pharmacist to be able to do this. And you have to receive a certificate from the Board of Pharmacy that gives you permission to do this. And the certificate is issued by the board so long as you've completed the 20-hour training program that the board prescribes that you will see in the rules. It's a 20-hour initial program that you take. You don't have to do it every biannual renewal period. It's just a one-time program that you take. The education must be approved by the board in consultation with the Board of Medicine and the Board of Osteopathic Medicine. And over the past several months, they've been meeting regularly to discuss draft rules. The Florida Pharmacy Association did provide some some language to the board for them to consider in that area. So the next question I think you want to ask is, what has to be in this educational program? And are there any available just yet where we can go and take right away? Well, not just yet. That's because the rules aren't final. Once the rules are noticed and published, there's a waiting period of about 21 days to get opportunity for public input or any revisions that may be necessary. The language in the draft rule has to address patient assessments, must address point of care testing procedures, has to address safe and effective treatment of minor non-chronic health conditions, and also has to address identification of possible contraindications. And this really, in my opinion, is more of a review for current contemporary pharmacy practice, because a lot of this stuff we are trained to do anyway. Is there anything else I need to be aware of to assist patients with their non-chronic health conditions? Now remember, we're just talking about test and treat today. We're not going to talk about collaborative practice piece that was in this bill. We're going to reserve that for another webinar because there's entirely too much content to share with you in a 1-hour session. So if you're going to be managing patients with non-chronic health conditions under this protocol process and working with physicians, you may have to make sure you have $250,000 of liability, professional liability insurance coverage. And most pharmacists that are doing these kinds of services have that and more. Also, you have to report a diagnosis of suspected existence of a disease of public significance to the Department of Health. This comes into play when we have this pandemic that we're dealing with now, and if we're seeing evidence of these kinds of issues in some of these non-chronic conditions, we have to report that to the department so they can track some of these things that are going on. If there's a request by a healthcare professional or provider for patient records, there's a process to provide those records to the healthcare provider, and then you have to maintain records for at least 5 years if you're going to be in this program. Then the next question is, if I'm going to be treating and managing patients with chronic diseases, and I've tested them, and I've come up with an evaluation that suggests that there are certain things that I can do, what can I prescribe for these patients? Well, if you're familiar with current existing Florida laws, there's a short list of drugs that we can prescribe, but again, it's a short list. The Board of Pharmacy is required under this statute to actually develop a formulary, and we're going to talk about that a little bit later on in this discussion today. What about the testing part of the section? What can I do? Which tests can I proceed with? Well, pharmacists can use any CDC qualified CLIA wave test to guide diagnosis or clinical making decision. That's the language that was actually in the bill itself. Or a pharmacist may use wave test under the federal CLIA amendments under 1988, or a pharmacist may use tests adopted by federal rules, or pharmacists may use any established screening procedures that can be safely performed. And typically these are tests that either consumers can do themselves or with minimal support that can be done with a healthcare provider. Now, let's talk about the protocol procedures. How do we go about getting into this? What does a protocol look like? And that's a common question that many of our members are beginning to ask. Hey, I want to do this, but I don't know what a protocol looks like. And do you have a sample one? I'll be working with the volunteers of the association and creating a resource on the FPA website where you can go to. You can get samples of things like this. I think it'll be a great idea for our, as a member service. And I want to thank our Public Affairs Councils for assisting us with building this resource for you, and hopefully we'll have it ready. But we can't release it yet until we actually know what the board's final rules are going to be. The protocol must include terms and conditions imposed by the supervising physician related to the testing, and the terms must be appropriate for the training of the pharmacist. And you have to submit the protocol to the Board of Pharmacy, and the rules will kind of define what that is. Then the protocol has to include what categories of patients that you're going to be working with. And a lot of that's going to depend upon the relationship that you have with your medical doctor or osteopathic medical doctor in the providing of these services to patients with non-chronic health conditions. There's going to be some history taking you have to do. There's going to be instructions on treatment. There's a process and schedule for a review of what actions that you have to take. Any notification requirements under the protocol. So if you're working with a patient and you see something and you do something to the patient, the protocol may require you to report that to the patient's primary care provider. There may be other requirements that the board may want to include as part of this, and all that's going to be defined in the rules that we'll get to in just a second. So I'm missing something. Is there anything else that's in the statute I need to be aware of? Well, evidence that the board certification has to be provided to the supervising physician. So if you're going to be managing these patients, you provide to the physician you're going to be working with your credential. And a lot of that information is going to be available through the Board of Pharmacy because you're going to provide that credential to them anyway. You have to have proof or have approval by the owner of the pharmacy that you're working with. And to maintain that credential, remember I mentioned earlier that your initial certification program you take is going to be 20 hours. To maintain that status, you have to take a 3-hour refresher course each biannual renewal period. You may not have to do it if you're going to take that 20-hour program within 12 hours of your biannual renewal period. So, for example, we will renew at the end of September next year. So if you become certified after October, you may not have to do that 3-hour renewal CE for this program. You have to provide written information defined by board rule on patient follow-up with the physician. And the pharmacy has to display a sign advising the patient to seek follow-up care. Now, this whole section is not applicable to OTC products, so if you're helping patients with your OTC products, there's nothing that's going to change there. So now we're getting into the rulemaking part, and this is the new piece that we're sharing with you, and we're going to be providing a draft of the rules to the membership, hopefully in a stat news in the next day or so. So what are rules? And this is taking us back to our pharmacy jurisprudence classes that we took back in pharmacy school. So there's a list of rules that we have to work under now. So you have 64B 16-25, 26, 27, 28, and 29 that are related to various aspects of what it is we do in pharmacy. These various rules are dealing with the organization and purpose, for example, of the board, rules related to pharmacy licensure, rules related to the practice of pharmacy, rules that permits have to follow. There's even a section dealing with rules on animal control shelters. And there's a section of rules that deal with disciplinary guidelines. What's the range of penalties that we have to adhere to whenever there's something that goes wrong? Well, a brand new rule section is being created, a new chapter. That new chapter is 64B 16-31 related to test and treat. And also included in there will be the rules that you will see for the collaborative practice side of this statute that passed during the 2020 session. But we're going to talk about the rules related to test and treat today. Hopefully we'll get another webinar on collaborative practice to share with you what those rules are designed to do. Okay, computer got stuck. Here we go. So what are in these draft rules? So first of all, there is something called a test and treat certification application. So if you're going to provide test and treat services to patients, you have to apply to be a test and treat provider with the Board of Pharmacy. There's an application you have to fill out. Just about every application has a rule that points to it. Then there is a definition of what's in the certification program itself. And in the rule itself, under 64B 16-31.035, it talks about, let's see, where is it now? Here it is. In the certification course, the applications for additional course, again, the rule says it has to be 20 hours in duration and shall meet all of certain mandatory requirements. The course has to be offered by a program provider, such as an ACPE provider, or it could be offered, and I use the word or, it doesn't mean and, or it could be offered by the state's medical association. So they can do it as well too. The only thing is that in the development of these courses, the content has to be developed in conjunction with a pharmacist and a licensed medical doctor. So if you're a CE provider and you're going to provide one of these certification programs, you will work together with a medical physician developing content. The same thing occurs for our physician colleagues who want to develop similar programs. If they're going to do it, they have to employ the services of a pharmacist to help them guide through this in a collaborative arrangement. The course also has to include the laws and rules related to test and treat certification, and the writing and entering into a protocol. That's all part of the content. And no less than 8 hours of that 20 hours has to be at least done through a live format or a webinar format such as this. So you do a 20-hour certification program. Of that 20 hours, 8 hours of that 20 hours has to be through a live format such as what we're into today. Then there's the written protocol and written protocol submission. So when you get connected to a physician to do a protocol to manage patients with non-chronic conditions, you will have to, within 5 business days of entering into that relationship with the physician, submit that protocol to the Board of Pharmacy. That's in the draft rule under 31.037. And so once you've done that, you've fulfilled that obligation. And in the event if you continue providing those services, and let's say the physician you're working with really likes what you're doing and maybe want to expand your protocol, or maybe the physician is contracting the services he wants to provide and he might want to pull back on some of the things he's allowing you to do, then there's an amendment that they do. Now, there's no requirement in the draft rule to submit the amendment to the board, but you do have to maintain any amendments or changes to the protocol at your practice site. Then the question comes up to the formulary of drugs. So what is the formulary of drugs? And the board, in its infinite wisdom, actually adopted a formulary that pretty much says that if the FDA approves it, then as a pharmacist, you'll be able to treat patients with it under your protocol. Again, the only limitation is whatever the physician and you as a pharmacist agree to under the protocol. If you're treating a patient for certain non-chronic conditions, then you can prescribe anything that's on the FDA list, so long as your protocol allows you to do that. There is a limitation, and that's really in Florida laws as well too. We do not have the authority to be able to prescribe controlled substances, at least not yet. Then there's the issue related to patient records. You're going to have to keep records associated with this. And the rule essentially just says that if there is a request for records, you have to provide them. And I think the time frame is when that request comes in, you have to do that within 5 days of having that request received in your pharmacy. 5 business days rather, not 5 total days. All right, then there's the follow-up piece. And there's a fair amount of flexibility in this rule. So with the follow-up, obviously you want to circle back with the patient's primary care physician if you're managing the patient's disease that they're dealing with. And in the follow-up, you'll provide written information to the patient, advising the patient to actually seek follow-up care from his or her primary care physician. And you can do it either immediately after you perform the test, the screen, or the treatment, or you can do it as it's outlined in your protocol that you have with the physician. So if you want to deviate from that, if your protocol says something different, whatever your protocol says would be applicable and approvable by the rule. Or if as a pharmacist you determine in your professional judgment that the patient should follow up with his or her primary care provider, that's included in the rule as an option as well too. And then getting close to the last one here, the mandatory continuing education under test and treat, or rather mandatory, I'm not sure what that is, 45, I missed that. Oh yeah, the mandatory continuing education is really that every biannual renewal period, there's 3 hours that you have to do as a refresher to maintain your credential. And the last one here is something that we're now beginning to see in a lot of Board of Pharmacy rules, and that's reviewing all rules to determine whether or not they should be applicable or not. This is what I call a sunset rule. So over a period of time, the board will open these rules up and determine whether or not any changes have to occur or whether or not the rules need to continue to take place. This is a way for the department and all agencies to really clean up their rules. So we're going to start seeing more and more of these in the future. So at this point, I'm going to step back, and we have our General Counsel of the Florida Pharmacy Association, TJ Morton, that's going to share with you some other things that are going to help us deal with the testing and treating for success.
Okay, good afternoon. Michael, if you could just move on to the next slide.
Okay.
Thank you. So I'll jump right in and kind of talk about what tests pharmacists can administer in terms of COVID-19 tests. So maybe I'll give you a little background here. So on April 8th, the Secretary of the Department of Health and Human Services issued guidance that stated that pharmacists are going to be considered covered persons under the Federal PrEP Act for purposes of ordering and administering COVID-19 tests. And what that means is the PrEP Act provides immunity to individuals from any claims if they are considered covered persons under the Act. And so when the Secretary of HHS included pharmacists as covered persons, they basically provided pharmacists with immunity anytime they are ordering or administering COVID-19 tests. Now, there was some disagreement among HHS and some of the states as to what that guidance actually did. Some states felt that, you know, if pharmacists weren't licensed by the state or authorized by the state itself to order and administer COVID-19 tests, well, the PrEP Act didn't give them that authority to do it. HHS takes the position that the PrEP Act preempts any state law, and even if the state law doesn't authorize it, the PrEP Act did authorize it. So there was that uncertainty after the April 8th order. Florida State Surgeon General removed any uncertainty, at least with respect to Florida, on April 24th, when the State Surgeon General issued an emergency order that suspended a couple statutes that would have prevented pharmacists from ordering and administering COVID-19 tests. So as of April 24th, pharmacists in Florida can order and administer COVID-19 tests. Now there's a couple of caveats to that. The tests can only be ordered and administered at a licensed pharmacy. So you can't make a house call to a patient's house and conduct the test there. The other sort of issue is pharmacists can't treat for COVID-19. So you can order, you can administer, and if the patient comes back positive, you're going to have to refer the patient to a different healthcare provider to actually treat for COVID-19. The order runs concurrent with the governor's state of emergency, and the governor's extended the state of emergency in Florida until November 3rd right now. So as of now, COVID-19 tests can be ordered and administered by pharmacists until November 3rd, 2020. That order could be extended. The governor has extended the state of emergency 3 times already. So I wouldn't be surprised if it gets extended again. So now what tests can pharmacists administer for COVID-19? So it can be any FDA authorized COVID-19 test. There's a list of FDA authorized COVID-19 tests at the link in the slide there. And there's various different kinds of COVID-19 tests. There are diagnostic tests, which indicate whether or not the patient has an active infection. And then there's a antibody or a serology test, which indicates whether or not the patient has antibodies to COVID-19. As to the diagnostic tests, there's 2 different kinds. There's molecular and antigen. A molecular test tests for the presence of the virus's genetic material, and an antigen test detects surface proteins of the virus in the patient. There are currently, I believe, 160 molecular tests that have been authorized by the FDA, and only 4 antigen tests. Of the 150 molecular tests, only a handful are CLIA waived, and all 4 of the antigen tests are CLIA waived. I think there's in the range of 50 or so serology tests that have been authorized, and none of those serology tests are CLIA waived. So a CLIA waiver is an authorization that allows for a certain test to be performed in a facility that isn't necessarily a laboratory. So you have CLIA issues certifications for moderate complexity tests. They issue certifications for high complexity tests, and then they issue the waived tests. If you want to conduct the COVID-19 test in an actual pharmacy, you will have to have a CLIA waiver for the pharmacy, and the test will need to be a CLIA waived test. So when you go to that link there that has the FDA authorized test, you'll need to look for the tests that have a W next to them, which indicates that they're CLIA waived. If you're conducting a test that is not CLIA waived at a pharmacy, all you can do is collect the sample, and then you would have to ship the sample to the appropriate laboratory to conduct the actual test on the sample. There is a how-to recorded webinar and FAQs in the FPA's COVID-19 Resource Center that talks a little bit more about this. So Michael, yep. Thank you. Okay, so moving on to obtaining a CLIA certificate of waiver. In order to obtain a certificate of waiver, the pharmacy will need to complete an application for certification and file it with the State of Florida's Agency for Healthcare Administration. I've included the address here on the slide, and you can also email that application to the email address listed. The application form can be downloaded from the Centers for Medicare and Medicaid Services website, and the NCPA has prepared a video that assists pharmacies in completing the application form. The form's not terribly complicated, but that video is really helpful in kind of helping informing you how to fill out certain parts of it that aren't completely self-explanatory. So it's a good resource. And also, there is an annual fee, or actually it's I think a biennial fee for the waiver. It's $180 every 2 years. Reporting COVID-19 test results. Any pharmacist who orders and administers a test is required to report the results to both the patient and the Florida Department of Health. The Department of Health has established a secure electronic reporting system for reporting the results. And anyone who wants to conduct testing needs to contact the Department of Health at the email address listed in order to create an account so that you can report the results directly through that electronic system. Potential liability related to administering COVID-19 tests. As I mentioned, the Department of Health and Human Services guidance that authorizes pharmacists to order and administer COVID-19 tests states that any pharmacist who does so is entitled to immunity against claims for loss relating to the administration or use of the test. So that's a pretty broad immunity protection. It certainly wouldn't protect against any sort of willful negligence or anything like that, but just any sort of negligence that results in a potential liability is possibly protected under this PrEP immunity. I would encourage any pharmacist who is conducting the test and has questions about the scope of the liability to certainly speak to their attorney about that. But just be aware that there is a liability protection based off being authorized under the PrEP Act. Pharmacists role in COVID-19 testing. So I've kind of gone through this already with respect to the State Surgeon General's emergency order. It's suspended section 483.813. That is a statute that requires anyone who's conducting tests to be licensed as a clinical lab personnel. So that doesn't apply to a pharmacist who is conducting COVID-19 tests. It also suspended section 465.00313. That is in the Pharmacy Practice Act, and that basically would have prohibited pharmacists from conducting COVID-19 tests, and they suspended that statute, so that no longer would be an impediment. And as I mentioned, this State Surgeon General's emergency order runs concurrent with the governor's emergency order. So as long as we're under a state of emergency in Florida, pharmacists are authorized to conduct COVID-19 tests. I think I've covered this slide already. I think it's just a duplicate. And the FPA has a how-to video on COVID-19 testing. And there's the web address at the bottom that provides more information. And as I mentioned earlier, it's got frequently asked questions regarding COVID-19 that covers in depth, basically what I've mentioned here, and a little more things such as record keeping and things along those lines. So I would kind of mention, although this isn't really the focus of the presentation today, but recently the Secretary of Department of Health and Human Services issued another guidance that authorizes pharmacists to administer vaccines to children between the ages of 3 and 18. As I'm sure everyone's aware, Florida law does not allow pharmacists to administer vaccines to children between 3 and 18. So we're kind of in that situation again we were in before the state surgeon general issued their order to allow pharmacists to conduct COVID-19 testing. We're kind of in a gray area right now as to whether that PrEP Act guidance from HHS preempts Florida law and allows pharmacists to now start administering vaccines to children 3 to 18, or Florida's law kind of controls. And we've reached out to the Department of Health Board of Pharmacy to get clarification on that, and fortunately they haven't given us a response yet. So I think that'll be the subject of an upcoming webinar.
Okay, TJ, thank you so much for being with us today. I appreciate your work there. We have our final session that we're going to do here. We're bringing to you Griff Danheim with Quidel, and also we have a pharmacist, Hamilton Borden, from Marysville, Tennessee, to talk about what he's doing in helping and managing patients with non-chronic health conditions. So I'm going to step aside and get Griff in front of you. Thank you.
Great, thanks, Michael, and happy to be with y'all today to take a few minutes to talk about our point of care testing device. It's been wonderful working with the team here in Florida over the last 3 years to get us to this point. And also thanks to Hamilton for making time in his day to speak with you as well. Hamilton's a practitioner from Maryville, Tennessee, who has a very forward-looking practice and has done very well with point of care testing in Tennessee. So we're just going to run through some slides quickly here about point of care testing and the ways that pharmacy meets the needs of patients. In studies, we've seen that it increases access to care, provides more affordable care and more appropriate care. When you look at these numbers and percentages, it's rather striking about the impact that community pharmacy does have on care for the general public, especially as it relates to the non-chronic illnesses such as strep, flu, and now COVID-19. So the device that we use for this is our Sofia 2. Sofia 2 is a touchscreen device that, as you can see, gives a very clear definition of whether a test is positive or negative. It does have a built-in data chip which allows for transmission of non-patient specific data to a cloud for your review, and also allows you to view test results from zip codes national. It's a very simple device to use. It has 2 modes, walk-away mode and read now mode, which can be used for batch testing. And as we know, one of the critically important things of influenza is having that disease determined within the first 48 hours. And with that process, Sofia detects that influenza virus 100% within that 48-hour window. A test is very simple to put together. After the swab is taken, reagent goes into the test tube, swab goes into the test tube, the solution is withdrawn, placed into a cassette, then the cassette is placed into the Sofia 2 instrument. This is just a quick general example of your return on investment from very low levels of testing. So if you look at your cost versus a normal average retail cost, with the exception SARS antigen is probably being reimbursed at much higher rates if you're able to report that for reimbursement. But if you look at your margins per test, and then look at your potential store margin, you can see that it's very striking as an addition to your clinical practice and something that you can offer patients. This margin does not include additional purchases made while they're in your store or other services that you are offering. So let's shift gears real quick here and talk about testing for COVID-19. Currently, Quidel has an antigen test on the market. An antigen test is very similar to a flu test for COVID-19, where it detects whether you currently have the disease or not. So this is especially beneficial when you're testing for folks that need to go to work, that need to return to work, schools, et cetera. So there's a wide range of use that you'll be able to cover in using the SARS antigen test. So this test is currently available. We do have an antibody test, which we're just awaiting final FDA approval on. And the antibody test, as you know, identifies past infections. So it's whether you've had the disease in the past or not and have antibodies in your system against that. So in addition to the SARS antigen test and the antibody test, we are also awaiting final approval on our dual channel test, which will be for influenza A and B and COVID-19. So you'll actually be able to determine any one of those three or all three in one test. And this is used on our Sofia 2 instrument as well. So the reason we want to use the Sofia 2 is just that it's a point of care device. It's very rapid to use as far as a test result. You do have the ability to do batch testing where you can do up to 40 to 50 tests per hour. Our assay performance and then your connectivity that you have for results. The Verena platform that I mentioned briefly, you're able to drill down to zip code level nationally to see where disease is present for COVID-19 and influenza. Currently, we have about 50,000 Sofia 2s across the country, so there's a great deal of data that we're pumping through that system. So when you look at our test performance, we are 100% specific to the COVID-19 virus. There is no cross sensitivity of that test, and we're currently at 96.7 sensitivity. The sensitivity will very probably continue to increase as we continue our clinical data gathering. So what are the next steps that you need to accomplish point of care testing in your practice? You need to apply for your CLIA waiver, all the items that Michael had described you need to do. You need to establish your CPA with your physician. As far as acquiring the instrumentation and tests from Quidel, you'd need to fill out a customer information form that I can provide for you, and then I'll send an agreement to you. You can contact me at the email address listed, and I'm more than happy to answer any questions you have and provide additional information for you. And that's all for me, and I'd like to welcome Hamilton Borden now. And Hamilton, you have the floor.
Awesome. Can you hear me loud and clear, Griff?
We can.
Awesome. Well, I appreciate you guys having me. And the one thing that I will encourage you guys is that pharmacy can do this and we can offer it at a high level. We are very well equipped within the pharmacy to be able to take great care of people. So two things that Griff hit on is access and affordability, and I would 100% agree with that. Y'all know the stats, something like 95% of people live within 5 miles of a pharmacy. And the great part about pharmacy is that people don't need appointments. If you've got after hours, if you've got weekends, the doctor's office is slammed. They've got the ability to be able to come to the pharmacy, and patients love it. Patients love to be able to provide point of care testing at the pharmacy. We were the first pharmacy in Tennessee to be able to provide point of care testing strictly through the pharmacist rather than having to go in through a walk-in clinic. So our practice is in Maryville, Tennessee and Alcoa, Tennessee. And again, patients love it, especially moms, for the ability to be able to come in without an appointment, to be able to come in and out. They can pay for the test, and while the results are coming back, they can leave. They can go grab some ice cream for their kid if they're not feeling well. The access and for the ability for patients to have that access is huge. Even 3 years ago, whenever we had a really bad strain of flu coming around, a local pediatrician's office ran out of tests. And where did they come? Their patients came to Blunt Discount Pharmacy because there was better access. This is great for public health. This is great for patients. And obviously it's a win for pharmacists as well. So I would highly encourage you guys to be able to do this, because we can do this and we can offer it at a very, very high level. And not only is that for flu and strep testing, but that's coming in for COVID-19 and the detection of the SARS-CoV-2 virus as well. So we're working with Griff on getting all that set up for Blunt Discount Pharmacy as well. But think of this as immunizations. So initially, whenever patients were coming in for immunizations 15, 20 years ago, patients would have to pay cash. And patients did that because we had access, and they enjoyed that access. Same thing with flu and strep testing. And with as many patients as we're going to have demand that access, we're going to look back in this another 5, 10 years from now, and that's going to be another benefit that patients are going to be able to get at the pharmacy. It's going to be something that's going to be able to be billable and reimbursable at the pharmacy level. So I can 100% attest, with being on the front lines, that what we do changes lives. For, just like Griff said, the access and the affordability, huge for public health, and especially within the SARS-CoV-2 as well. So again, I'm here to be able to encourage you to say we can do this, and we can offer it at a high level as well.
Okay, thank you so much, Hamilton, for being with us today here in Florida. We hope everything's going well for you up there in Marysville, Tennessee. Ladies and gentlemen, that's the end of our session that we had for you today. Thank you for being with us. We have a couple of questions here in the chat. I think I can answer both of them here. First question is the 20-hour, not chat, it's in the Q&A section. Is the 20-hour course for test and treat currently offered in Florida? The answer is no, it's not currently offered in Florida, because we are waiting on the Board of Pharmacy to do rules. So once the rules are developed and finalized, then providers can then building these educational programs to help get you prepared to do test and treat. And then the next question here is, will the programs available in California, the advanced practice pharmacist, or other states meet the requirement of the 20 hours that may be required by the Board of Pharmacy? And it's very likely that they will be. We just have to make sure that those programs include the components that are identified in the Florida rules. So for example, Florida rules require the program to include state regulations on test and treat. And so if you have other states that are doing these programs, they have to submit the program to the Board of Pharmacy for review and approval. And they have to make sure that the programs are developed in collaboration with a licensed healthcare, a licensed physician or a pharmacist. Okay, then the question here from Wayne, thank you for asking, who actually is allowed to administer the tests? So I'll take a guess here. I have to rely upon maybe TJ to validate my response, because he has the JD and I don't. But I think the statute was written to the pharmacist to do. So is this something that you can delegate down to your technician? I am not certain on that. I don't think so. But I think the technician can assist with some of the things that you have to do, such as record keeping and gathering supplies and getting the machine ready and things like that. But I think it's the pharmacist that actually has to perform the test.
Michael, I would agree with you.
Oh, I got that one right. Great. Okay, here's the final question that I have here. In Florida, does the rule include age of patient for test and treat? And that's a very interesting question. I think the statute and the rules don't really point at an age requirement here. So I think if you can work with the patient's coming into your pharmacy, be it a pediatric patient or an adult or a senior, that if it's within the protocol that's signed by the physician, that you should be able to do that. ALOS says, as a Florida pharmacist, one has to wait until the board finalizes a rule on a 20-hour education and not go about fulfilling educations offered from other states. Correct? And that, I think, is a good thing to do. Now, you can go ahead and maybe take some programs to maybe prepare you for the certification program that you want to take, but I think the way it works is you take the programs after the rule has been finalized and not before. I know everybody wants to get a jump on this, and I know I do too. And there are lots of programs out there will likely meet the intent of the rule, but it only becomes appropriate and effective until after the rule has taken effect, and then you can take the program, be qualified. Great question. Really appreciate you doing that. Okay, ladies and gentlemen, I think that's it for today. I have 3:52. Thank you for being with us. That's the end of our session. Certainly, it's our intent to try to get this information published on our website and available to you. And stay tuned that hopefully downstream, when the board finishes rulemaking, we'll have a program and developed and ready for you to advance your practice. Thank you again, everyone. That's the end of our session. Have a great afternoon, and everyone, please stay safe.